Langat is the chairperson of the Tenwek Hospital Board. He also serves as a member and a trustee of the Mission for Essential Drugs and Supplies, MEDS. Thank you, Bishop, for joining us tonight. Now, the health facilities that are held or owned by yourselves, that is, of course, the faith-based organizations, are some of the most important institutions, especially in the rural areas. They go-to places in terms of health facilities. You're saying you're reaching breaking point. Please paint a picture for us.
We are in a crisis. And our message to the government of Kenya, and particularly the leadership in SHA, is that we have never reached such a crisis as faith-based facilities. We provide 40% of the health provision in our nation. We are a key pillar in terms of provision of universal health coverage for the nation of Kenya. We are not for profit. The faith-based facilities and the religious leadership behind them are not intending to be at war with anybody. We have been for years, for generations, the main partner for the government of Kenya from the days we were founded by different mission organizations. And so we are telling the government, do not lead us into temptation. We normally speak the language of compassion and love and reaching out, and all we need is pay us.
All right. I remember a meeting at Fungamano House, the same place where you had a meeting today, to give that 14-day ultimatum, and at the onset of the rollout of SHA, that is October last year, where you met the medical services PS Hari Kimtai, and there was a very good camaraderie between the FBOs and the ministry, even a program to work together to urge Kenyans to register for SHA. It seemed like the future was bright at that time. When did the brain start beating us?
We supported the rollout of SHA because the philosophy, the principles behind it are magnificent. Any nation that is able to roll out the universal health care is beautiful. I mean, that's amazing. But the government has been shifting, and the system is not clear how it is being rolled out. You are given the promise that money has been paid, but if you ask our facilities, nearly 50% of SHA, we're not talking about NHIF, has not been paid. So that's where the problem is. The payment is promised to come, It is not coming. We are now being put into a verification process. And the question we ask ourselves as faith-based is, do we truly have some of our facilities that are making false claims? That goes against the tenets of these faith-based facilities. That's the question, the big question we have for the government.
All right. And the big number for you is the 10 billion shilling debt that you want the government to pay. Talk to us about this figure.
The 10 billion is split into three major components. We have the NHIF, which is unsettled. We do have the MAKL for the teachers and the Askaris. We do have SHA, which is meant to be paying on a monthly basis, is also behind. So the total is 10 billion for all our faith-based facilities across the country.
All right, just clarify something very quickly for us. The government sent a statement yesterday saying they had cleared the NHIF debts, and even RUF are reinstating some of their services. Has that payment not been done to yourselves?
No, the NHIF, they're talking about clearing the SHA, but NHIF, they are putting it into a 90 days verification process.
Okay.
What they are only clearing is the 10 million less. But what we're saying as religious leaders is 10 million for major facilities like Tenwek Hospital, which does critical services that their claim in only 1 month may go even up to 100 million because of the level of provision, the number of specialized surgeries that they are doing. So the 10 million may only affect small facilities around the country, but not the faith-based, major faith-based hospitals.
I was following today's proceedings that one of the complaints is that the SHA system is too bureaucratic. Is that a concern from where you sit? And isn't that a better problem than one system that is too easy to manipulate?
Well, we are for a system that is foolproof, that is tight enough to protect the resources of the population. But we were promised that SHA will be effective, but it has 10 stages of approvals and processes within it that are too bureaucratic. It is really NHIF reborn, and it's not creating any efficiency, at least not yet.
All right. Yeah. From where you sit, before I let you go, what is the long-term solution for the Social Health Authority? There's a lot of complaints from all quarters, a lot of impact you see in hospitals. The government insists it has to work. What's the way forward from where you sit?
As I said, it is a brilliant idea. And I think we don't want to appear like we're fighting with the government, we're fighting with the system. What we are saying is the principle behind SHA is fantastic, but it needs funding, it needs integrity in the system, it needs continuous dialogue. One of the biggest challenges is that we do things as Kenyan in a populist way.
All right.
It needed a lot of thought, it needed a lot of planning within it, and a lot of preparation of the system before you roll out.
What is going to happen after 14 days if the government does not pay 10 billion debts?
What's going to happen is that, and we hope that the government would listen and really pay. As I said, don't lead us into temptation to have to close out services from very needy patients who need our help. So what will happen is that we will continue offering services, but on cash basis. We have already closed out, some of us have closed out MKL already. So what will happen is that the 40% of health provision in this country in 14 days will have to be on cash basis.
Thank you, Bishop. We hope it doesn't come to that. Thank you for your time tonight.
We pray so. Thank you so much.
Bishop Dr. Robert Langat, Chairman of Tedwek Hospital Board, also a trustee and board member of MEDS, the Mission for Essential Drugs and Supplies. Thank you so much.